One of the biggest tools in stopping the spread, of course, is direct contact tracing. It's something that staff and volunteers at the Kent County Health Department are doing right now every day.
You have to know where it's been. Our Angeline McCall has a closer look at their process.
Contact tracing has been around for decades as a tool for public health agencies to track down anyone who might have gotten a virus or bacteria such as tuberculosis or HIV, but never to the scale that we've seen with this pandemic, considering that Kent County is seeing anywhere between 80 to 100 new cases per day.
At the Kent County Health Department, around 70 staff are constantly on the phone, contacting anyone who may unknowingly be sick.
We work from 10 o'clock to 8 o'clock on contact tracing activities. And so from the moment I get here in the morning, 7:30, I'm looking out for new cases, identifying cases that need to be contacted, doling those out to the teams for investigation.
Kent County epidemiologist Brian Hartle is leading that team. So this is how it works. A contact tracer is responsible for finding out who that one positive COVID patient has been in contact with. For instance, they might have to track down the 5 people they've been in close proximity with during the 48-hour time period prior to symptoms. Then if those 5 people show symptoms, the process starts all over, tracking down the others they could have infected.
So it's really something that can balloon into a much larger investigation depending on how many of those close contacts actually have symptoms.
In the past, they've worked mostly via phone to contact up to 20 directly exposed individuals for just one infected person, with a recommendation to isolate to slow any additional transmission, which could in turn save lives.
I think it's a very important piece of controlling the spread. Obviously, when we educate the patients themselves and talk to them about isolating themselves for the period of time when they have symptoms and 10 days after the onset of their symptoms, at least 10 days, that helps contain the individual from spreading it elsewhere.
The Kent County Health Department is still working on finding volunteers. The first cohort of volunteers just recently went through training, but they're still looking for more. If you'd like to help, we have that information on our website at fox17online.com. Reporting in Grand Rapids, Angeline McCall, Fox 17 News.